afternoon. Thank you for joining our webinar today on how Medicare impacts health savings accounts. Our first presenter today is Whitney Johnson. Whitney is an attorney and founder of HSA Resources. He literally wrote the book on HSAs for Professionals with Health Savings Accounts Facts, published by National Underwriter. He is a frequent speaker and writer on HSA topics. Our second presenter is Jim Spaniel. Jim is the Health Savings Account Manager for HSA Resources and Falcon National Bank. Jim has over 30 years of experience in the financial services industry, specializing in retirement products, and has been working with health savings accounts since the beginning. He has conducted well over 1,000 seminars and webinars throughout the United States. My name is Stacy Graham. I will be the moderator today. I am the HSA Office Manager here with HSA Resources and Falcon National Bank. I have over 15 years of banking experience and have been working with health savings accounts since the beginning. Our agenda today will talk to some key issues that people entering Medicare find themselves facing. We will touch base on Medicare's impact on HSA eligibility, final year's HSA contribution, HSA distributions to pay for Medicare, HSAs as general retirement plans at age 65, and at the end we'll have time for questions. If you have questions along the way, please submit via chat. A little bit of trivia here before we begin. Clients turning 65 in 2015 were born in 1950. A lot has changed in 65 years. The life expectancy back in 1950 was 68 years. Today the life expectancy is 81 years. The federal minimum wage was 75 cents versus the $7.25 it's at today. And a new car costed about $1,500 back in 1950, and now we're at $33,500.
I grew up in the 50s. I remember wearing sunglasses with holsters on it. Boy, I was the hottest kid in the neighborhood back then.
Part 1 talks about Medicare and HSA eligibility. Whitney will lead our discussion today talking about what happens when my client turns age 65.
You know, and the key thing that happens when a client turns 65 is they generally enroll in Medicare. And really the Medicare discussion and this topic is a big part of our presentation today. We've got a picture of a mousetrap on there because part of what we want to convey to you today is there are a lot of traps in this area. The rules here are good for HSA owners, but you've got to be careful because it's relatively easy to make a mistake, especially regarding this loss of eligibility. We also do want to talk about how when you turn 65, you can use your HSA to pay for premiums, including Medicare premiums. That's a huge benefit that's undersold, and we want to make sure everybody understands the rules there. Finally, we're going to talk about HSAs for general retirement use. Not an ideal use, and we want to make sure people understand why that is.
What Medicare plans make a person ineligible for an HSA? You know, a couple statistics on this. If you turn 65 in 2014, you could have over $200,000 in medical expenses that Medicare does not cover. You know, that would include your deductibles and some of the out-of-pocket expenses. But when you look at the different parts of Medicare plans, you've got Part A, which is hospitalization. You've got Part B, the medical insurance. Medicare Part C, which is really private plans that replace A and B, and possibly D. Medicare D, of course, is prescription drugs, and then there's Medicare supplemental insurance, which is Medigap, which again is not being paid by your HSA for that part. But all these could actually make you ineligible. Now, you know, you look at your paycheck. We pay approximately 1.45% of our paycheck out of our W-2 to take care of the Part A. That is the mandatory piece. You know, Part B, the medical insurance, is really optional, which is generally 80% covered and 20% is not. Now, there is going to be an additional tax currently, at least proposed, of 3.8% for investments income in excess of $250,000 for married couples filing jointly. So they're needing to pay more of this Medicare piece. In addition, married couples who file jointly have earned income in excess of $250,000 will have a 0.9% increase in their check to pay for these Medicare pieces.
You know, one of the tricky things is why does Medicare enrollment end HSA eligibility? This is not a huge trap, but the law for HSAs actually has a special provision specifically stating that once you enroll in Medicare, any of the Medicares Jim just covered, you are no longer eligible for an HSA. The law also has another provision that says if you really enroll in any health care other than high deductible health care, with some exceptions listed on this slide, but if you enroll in any health care, you lose HSA eligibility. And I think this has caused a little bit of a problem because the IRS early on saw this special Medicare rule and they started just saying people weren't eligible at age 65. And I think they fixed most of those materials, but it's still kind of set into the lexicon of HSAs that when you turn 65, you lose HSA eligibility. And that's simply not the case. It's only if you enroll in Medicare. And we're going to talk more about that. We also want to use this webinar just to point out a couple current events. This one is the Veterans Health Care Choice Improvement Act. This just passed July 31st this summer, and so it's current. And what this is a law that President Obama signed that allows veterans to use the VA clinics and hospitals and not lose HSA eligibility. Prior to this law, the IRS had interpreted the VA as if you used it, you were ineligible for the HSA for 3 months. That caused veterans hardship, it caused employers hardship, and that law is now gone. The next kind of little bit of a trick is when do you lose HSA eligibility? Well, if you read the law, the HSA law says you check HSA eligibility as of the first day of the month. So if you're eligible on the first day of the month, you're given credit for being eligible that entire month. Medicare can cause a little bit of a twist on that because you might enroll in Medicare today. And if you enrolled today, you might think you were eligible as of the first day of September. But the way Medicare works is they back up your eligibility as of the first day of the month you turn 65. So because you were eligible on the first day of September, even if you turn 65 later in September, you actually lose eligibility as of the first day of the month. Not a huge issue, but it's something that we have seen some people confuse. I also wanted to point out on this slide, we have included in the materials, it's in your handout section if you're going to download it, and we plan to email these later, both the PowerPoint presentations and all of our worksheets. These have always been available for you to use. We want to use this webinar to highlight some of the worksheets and make sure you're aware of them to hand out to customers. So HSA eligibility and contribution worksheet is the first of many you'll see today, and there's even more in the materials to kind of just think about handing it out to a customer. It allows you to give a quick answer and then back it up with some more detail. I said we'd come back to this being eligible for Medicare versus enrolling or being entitled to Medicare. This is a pretty tough topic, and this is more of a trap area. But individuals that turn 65 sometimes are automatically enrolled into Medicare by the government. One example of that is if they begin to receive Social Security, they're automatically enrolled in Medicare. Another example of that is if they work for a small employer. If you work for an employer with fewer than 20 employees, Medicare becomes your primary source of insurance, even if you have employer-provided health insurance. And because Medicare is primary, then you really become ineligible for an HSA. However, most individuals that do not actively enroll in Social Security or begin receiving benefits under Social Security, do not enroll in Medicare, will remain eligible for an HSA for as long as they continue to not do that. So we have many customers that are in their late 60s or early 70s that are continuing to make HSA contributions legally because they've retained their HSA eligibility. One other little caution, though, is to be super careful here. We have also dealt with numerous customers who have called us after, I would say, being caught. And the way they got caught was they were over 65. They thought they never enrolled in Medicare because they never did anything active to enroll in Medicare. They continued to make HSA contributions. They then incurred large medical expenses, large enough that their employer-provided health insurance looked into it and discovered that Medicare, in fact, was the primary provider. The insurance company was able to shift that cost to Medicare, but then the HSA owner was stuck dealing with backing out these contributions as excesses, and that's something nobody wants. So the warning here is be very careful advising clients about they have to be extra careful to make sure they're not enrolled in Medicare.
Very good. Thank you, Whitney. And because that is kind of a tricky topic, we have a small polling question here for you. Can an individual already enrolled in Medicare or Social Security still make an HSA contribution? So put a little polling question out there. Looks like we have some votes in here, so we'll get that closed down. We'll share the results.
And the quick answer to that is you can still continue to make contributions. So if you are over 65, enroll in Medicare, you are allowed to make contributions for the time period prior to being, when you still were eligible. This question comes up not just with Medicare. So a lot of times people will be eligible for an HSA for part of the year, but then not make a contribution. And can they still open an HSA, really, and make a contribution even though they're no longer eligible? The answer is yes, provided you're making a contribution for a period when you were eligible. So if somebody turns 65 mid-year and then enrolls in Medicare, they lose HSA eligibility, they can continue to contribute as long as they're below their pro rata amount for the year. And the slide here is really getting at a very similar question, is what does an employer do when an employee turns 65? Do you shut them down immediately? And I think that often is the right approach, because when somebody turns 65, they are enrolling in Medicare, they do lose HSA eligibility. But there is some mushiness around that. One issue is if they in fact don't enroll in Medicare and they do retain their HSA eligibility, the employer must continue to make employer-provided tax-free contributions for the employee, because the employee will retain HSA eligibility. If the employer offers payroll deferral through a Section 125 plan, the employer must continue to allow a person over 65 to make those deferrals if they remain HSA eligible. And an employer can continue to allow HSA deferrals or make contributions for an employee over 65, although they don't have to. And yeah, maybe it's better to talk just about payroll deferral. The payroll deferral, you could allow an employer to continue making contributions to somebody over 65 so long as they stay below their pro rata limit for the year. So somebody putting $100 a month from payroll deferral, it depends what month they turn 65, but assuming it was in September, they're going to be fine doing $100 a month, $1,200 total for the year. You don't necessarily need to stop them mid-year so long as they stay under their pro rata limit for the year.
Very good. We have another question here talking about Social Security. Can an individual already enrolled in Medicare or Social Security opt out and regain HSA eligibility? We'll launch a quick poll here, see what you guys think. Okay, looks like most of our answers are in here. All right, let's share our results.
Okay, and to talk about this and piggyback off Whitney's comments, actually, it all depends. You can opt out of Social Security payments. Now, the general rule is early retirement in Social Security is generally 62. Normal for most of us is 66, 67, and usually you can wait as long as 70. Now, what generally happens when you turn 65. You get an initial enrollment questionnaire, and it's important to respond to that questionnaire from the IRS. This question, or the Medicare office, they will ask whether you want to enroll. And again, if you enroll in Part A, which is the hospitalization, which is actually required, Part B, remember, is the medical. That's optional. But what can happen is there are some clever people that actually who have an intention of collecting early Social Security just to invest the difference, and they plan on opting back in or opting out of Social Security, and they can actually repay those payments back to the government. And they don't have to include any earnings, which is kind of unique. The same issue applies to Medicare as well. If you pay back all your medical claims that had occurred, you can actually opt out and therefore be HSA eligible again.
Very good. Thank you, Jim. Calculating the final year's HSA contribution can be tricky, but it doesn't have to be. Jim will lead us off by talking about the calculation.
Yeah, if a client turns 65, how much can she contribute in that final year? And this is where you get into this pro rata calculation. And again, remember, when you turn 65, 3 months before that, you'll get this initial enrollment questionnaire from the Medicare office. Again, you want to respond to it. But let's look at a couple of examples that we have in our outline. Jim's covered by self-only plan, high deductible, and becomes no longer eligible due to Medicare enrollment July 1st of 2015. Jim is eligible for 6 months of the year. So the federal limit for self-only is $4,350, which would be the $3,350 plus the $1,000 catch-up. So when you look at his calculation, basically said 1/2 of $4,350, or $2,175, would be Jim's allowable contribution for 2015. Now, believe it or not, he could, even though he enrolled in Medicare, didn't make a contribution, he would actually have until his tax due date, excluding extensions, which would be April 15th of 16, to fund for the 15 tax year, if he happened to not make that contribution yet. Now let's look at the second example. We've got Jim and Debbie. Jim's 65, Debbie is 60. They both have a family HSA. Jim enrolls in Medicare July 1st of 15. Debbie now has self-only plan as of July 1st of 2015. Jim and Deb's allowable contribution for family would be basically 1/2 of $76.50, which would be the family amount plus Jim's catch-up. That equals $38.25. Now Debbie switches over to self-only, and she can do 1/2 of $33.50, plus again, she's eligible for the full $1,000 catch-up. So $16.75 plus her $1,000 catch-up, or in other words, $26.75 would be Debbie's allowable contribution for self-only for that remaining half of the year. Now the next question that we get is, are catch-up contributions pro rata? And really there's three kind of concepts I want to illustrate here. The first issue is, when did you turn 55? And a simple way of looking at it, as long as your age at the end of the year is 55, you're eligible to make the full contribution. So that's one concept. But we're going to work on a couple of caveats. What if Jim quit during the year and he decided to work for a different company that had a traditional health plan? There, in that case, we're going to have to calculate the pro rata. So if I had half a year's worth and I moved over to a plan that was no longer a high deductible health plan, I could basically contribute $500 on my catch-up. But then there's the last concept about when you are eligible for as of December 1st of the year. So you didn't have a high deductible health plan at the beginning of the year, you had one at the middle of the year. As long as you are eligible on December 1st, you can make the full contribution. However, in that case, there's going to be a testing period where I must remain eligible for the next 12 months.
The earlier polling question, one of the questions was, can you remain HSA eligible after turning 65? And there was a spouse answer in there. That's really correct. Having a younger spouse can help quite a bit with HSAs, because often there's really no effective change for the couple that has this situation where the older spouse is making the contribution, turns 65, enrolls in Medicare. They just shift everything to the younger spouse, and it works pretty slick. I do want to go through 3 little traps that we've seen in this area. And the first one is based on HSAs are all individual accounts. And anybody that advises on HSAs really should keep that in mind, because it comes up not just here but in other areas as well. The IRS and the law itself kind of messes that up, because they talk about family versus self-only, but then they use the IRA structure to build HSAs. And HSAs are built on the fact that it's an individual account. So when a couple thinks they can just shift the younger spouse, in one sense that's really true and it all works slick, but in another sense they're likely to have to open a new HSA. If both spouses didn't already have HSAs, the spouse that's still eligible will have to have the HSA in his or her Social Security and their own name. So you can't just kind of move this money back and forth. And the reason why people think you can move the money back and forth is because the law says kind of that. They also say that if a married couple, if one married couple has family eligibility, they're both considered to have family eligibility, and the 2 of them together are capped at the family HSA limit. That works to prevent 2 spouses from each getting the $6,650 contribution. So what does that mean? Well, it means sometimes people are going to have to open up an extra HSA, and they may or may not like that. Another thing it means is the catch-up contribution. The catch-up contribution goes to the individual that's over 55. It can't go into the other spouse's account. So if, let's say you have an extreme example, or you have somebody that goes on Medicare 65, they were doing $6,650 contribution plus the $1,000 catch-up, but they're married to a 50-year-old spouse. That spouse can make the full $6,650, but the $1,000 catch-up will be lost. Once that spouse reaches 55, then he or she can make their own HSA full family contribution plus the catch-up. The final trap we wanted to talk about here was with employer contribution. Quite often the person that has the HSA opened in their name is an employee, and they have it in their name because the employer may be giving free money to that employee's HSA. They may also allow payroll deferral, which avoids FICA FUTA taxes. If that individual turns 65, they're extremely likely to ask the employer, just make those free contributions and my payroll deferral into my younger spouse's account, and that's not allowed. The employers can only make contributions pre-tax to the HSAs of their employees. You can't do it to spouses. And again, it's somewhat basic, but we've seen this mistake made repeatedly, so you do need to keep an eye out for it. We also wanted to talk about, again, kind of squeezing in a law that doesn't directly affect Medicare, but it does affect the spouse issue we just discussed, and this is same-sex couples. We had 2 rulings on this in the last few years. In 2013, the Supreme Court struck down the Defense of Marriage Act. The Defense of Marriage Act defined marriage as between one man and one woman. And now that's important for HSA law because HSA law is federal law, and it was subject to the Defense of Marriage Act, and spouses had to be one man and one woman. In 2013, that law was unconstitutional, no longer an issue. In 2015, though, the U.S. Supreme Court said states must allow for same-sex marriages. So what this means for HSAs is we're going to start seeing more same-sex spouses, and spouses is the word the law uses, and those spouses will be entitled to all the benefits of spouses under HSAs. I'm not going to go through all of those today, but there are numerous benefits. The key one is you can use your HSA to pay for medical expenses of your spouse. But a trap here is that many same-sex couples will not immediately get married. And if they're currently domestic partners, they will remain domestic partners until they choose to marry. And if they're domestic partners, not spouses, they do not get the benefits of the spousal treatment. And what this means for the age 65 is kind of interesting. Before this, if you had 2 same-sex couples that were domestic partners, not married, and this will not change unless they get married, they each could make a $6,650 contribution if they were covered by one employer's family high deductible health plan, because they're each covered by a high deductible health plan that's a family plan, and they don't have to coordinate with their spouse because they're not married. Once they get married, they will have to coordinate, and that closes a loophole for same-sex couples that really, until this time, were able to get a double tax break, two family contribution limits, really for what most people would consider as one family. So we wanted to point that out to you as well. I've got one more tricky kind of a trap here that we want to cover for when people turn 65. This has to do with the HSA testing period. The testing period is one of the great overlooked items in HSAs. I don't think anyone gives it enough attention. Fortunately, the IRS hasn't been giving it a lot of attention either, so not many people have been caught on this. But there's kind of a lot of traps in this. And what the rule says that in 2007, this came into being because a new law passed in 2007 that said anybody that's eligible on December 1st of the year can make a full contribution for that year. And that rule is called the full contribution rule. But there's a catch. They have to remain eligible from December 1st of that year, let's say 2015, through December 31st of 2016, or they'll owe taxes and penalties. So what does this have to do with turning 65? Well, anyone that's turning 65, or pretty much anybody, because they mostly enroll in Medicare, knows they're going to lose eligibility. So let's do an example where you're working with a client today that's 64. You know they're going to turn 65 next year. You know they're going to fail their testing period. Anyone that's eligible December 1st of this year will be subject to the testing period. They must remain eligible through December 31st of next year. So they're going to fail that. So then the question becomes, okay, what does that mean? It doesn't mean anything if the person was eligible every month of 2015. So if they're 64 this year, they've been in the plan for years, they're eligible every month, a failed testing period results in no taxes or penalties. But you do have to look out for the person who just started their HSA when they were 64. Somebody who just starts their HSA 64. Let's say the person started July 31st or July 1st of this year. We'll give them 6 months of eligibility this year. Well, they're going to be eligible on December 1st. So somebody who knows the HSA rules pretty well will tell that person correctly that you can make a full, let's say they have a family plan. You can make a full $6,650 contribution plus a $1,000 catch-up under the full contribution rule because you're eligible on December 1st. That, however, is bad advice because they're going to enroll in Medicare next July. They're going to lose eligibility. They're going to fail their testing period. They're going to owe taxes and penalties if they do that. In order to avoid that, they need to do a pro rata contribution in their 64th year. And in this example, they could do 6/12. They're eligible July through December. They could do a 1/2 contribution. They really can't do the full contribution. We have a couple worksheets, again, to help them. This is your age 65 worksheet. This talks through most of the issues we are talking about today in a pretty plain English, and they're all 2 pages. We also have a testing period worksheet that gets more into the details of the testing period. The testing period is tricky. People don't think about it. I think so far people have been getting away with this, not following the rules. But the IRS has every little bit of information they need in order to catch people for breaking this rule. So I think it's just a matter of time before people start getting caught on this. If you hand clients this worksheet, I think it helps reduce your risk and the client's risk of making mistakes in this area.
Very good. We have another quick polling question. Back in 1999, approximately 18% of Medicare beneficiaries enrolled in the private health plans called Medicare Advantage. Any guesses on what the percentages are registered in 2015? We'll launch a little poll here. All right, looks like most of the votes are in, so we'll close that. We'll get the, there we go. All right. So in 2015, 31% have enrolled in the Medicare Advantage over the 69% that are in the traditional health Medicare. Another quick question. Back in 2000, there were 39.7 million of Medicare beneficiaries. How many do you think there'll be in 2013? Bear with me 1 second here. We'll launch a new poll. All right, looks like most of our votes are in, so we'll take a peek at that. All right, so in 2030, they're expecting 81.8 million beneficiaries to be in the Medicare.
Yeah, if you look at that stat and look at the growth, I read a statistic that you've got right now over 10,000 baby boomers who are retiring every day. So you can see there's certainly going to be a lot of pressure on Medicare. And by 2050, it'll be literally almost 3 times that amount. And you know, from a Kaiser Family Foundation poll, they look at what's the most important government programs. Actually, Social Security was 83% voted on and 77% voted for Medicare. So we know these two entitlements are huge programs that we all are relying on.
Very good. So our part 3 today talks about using the HSA for insurance premiums. Jim will lead us off on what types of insurance can an age 65 plus HSA owner pay for with the HSA.
Okay, as you see this visual, we've got all these different Part A, B, C, and D programs. Remember, if you elect to be in Social Security, you are automatically in Part A. And again, Part B, the medical insurance, is optional. Part C is, again, the private plans that replace Part A and B and possibly D. Part D is prescription drugs. And again, there's generally a premium for that, anywhere from $50 to $100. Another piece that you can use your HSA for is the employee health plan. Employees share premiums for employer-sponsored health care. It can be paid out of your HSA. Now, one piece that people need to be aware of is Medicare supplemental insurance is not an HSA. It would not be considered tax-free. But of course, a lot of people are going to buy the Medicare supplemental insurance because it protects you from the deductibles and the co-payments. There is a cost for that premium as well, anywhere from $100 to $300. Now, generally, when you look at it, Medicare payments are automatically deducted from your Social Security benefits. And that's what you can do is you can reimburse yourself from the HSA to pay those premiums later. So it's automatically taken out. Now, we're going to get an example on the next piece on the Part B premium. Now, a little history about Part B. It's an outpatient medical expense. It's optional, and again, it's offered to applicants who become entitled for Part A. And there are 5 components to this based on the calendar year. Medical expenses, which is going to be your physician services, surgical, physical speech therapy, diagnostic tests. You've got laboratory services, blood tests and biopsies. You've got home health care, which is basically for those who are housebound. There's medical care and outpatient hospital treatments and blood work. Now, this is basically based on a national fee schedule, based on the doctor, the value of each physician's service, and it also includes their work, their practice, and even malpractice insurance. Now, the rule of thumb is Medicare generally will pay 80%, and you have to come up with 20%, and there is an annual deductible for that. And this is generally coming out of your Social Security payments. Now, in this next example, we're going to analyze how this works. Now, this is based on the 2015 tax year, but the interesting piece is they look back 2 years and look at your income as of 2013 to determine what your premium will be paid in 2015. And as you can see, it's based on your filing status, whether you're single or filing jointly or separately, and what is your income, adjusted gross income. And as you can see by this table, there are basically 5 tiers of income, which will depend and determine what your actual premium payment will be. Now, for 2015, most people will likely be under that $104.90, which comes out monthly from your Social Security check. But you know, there's some interesting issues occurring. According to the Kiplinger newsletter, if Social Security has a COLA increase, everyone will see an increase from that $104.90 to $120, which is a 15% increase of that premium, assuming we have a Social Security COLA increase. But there's another issue that's occurring as well, where if you don't receive Social Security benefits and you have to pay that separately, that $104.90 can rise up to $159.30, which is a 52% increase in your payment. So unless this is rescinded later by Congress, that income fee could occur in 2016, which is pretty stiff. Further, there were studies with a couple retiring in 65 in 2034. That Part B premium could be as high as $19,000. So this is an ongoing expense. What a great benefit you would have if you have a decent HSA bucket to pay for those expenses, and that would result in tax-free.
We also want to remind people that you can continue to use your HSA at age 65 for other insurance premiums. These don't go away. Really, long-term care insurance is the only one on here that's relevant because you can use your HSA for health insurance premiums at age 65. We also want to point out one trap. A trap, I don't like this part of the law, and we've had a few clients that have kind of stumbled in this area, where if you are not over 65 years yourself and you're the HSA owner, you can't use your HSA to pay for Medicare and premiums or health insurance premiums for a spouse that is over 65. It's directly contrary to most of the distribution reasons. Generally, is if you're eligible to use your HSA for your spouse or your children, if they have a medical expense, you can use your HSA to cover it, but not for Medicare premiums. The individual has to be over 65. If the HSA owner is over 65, they can use their HSA to pay their spouse's Medicare premiums as well as their own, but the individual must be over 65. That issue is not true for COBRA, unemployment, or long-term care insurance. In those cases, the individual that has the HSA doesn't have to be eligible for those things so long as their spouse or dependent is eligible. We did include kind of the limits for the long-term care insurance just because it's a popular item to look at, and we don't want to mislead you into thinking that you can just do any amount of long-term care. It is capped how much you can take out tax-free from an HSA based on your age.
Very good. Using an HSA for general retirement. Jim, can an HSA be used for general retirement expenses?
And the answer, of course, is yes, of course. But you know, when you look at the chart, and I think it's a great tool, you want to get tax-free and penalty-free withdrawals. So why not use them for the correct reason, medical expenses and COBRA health insurance and so forth. That's a great way to maximize your tax issues. Now, one question we sometimes get is funeral expenses are not qualified medical expenses. Now, another look at that chart, taxable but no penalty. If you're 65, you could take it out and go on a Love Boat cruise if you'd like to. You simply pay ordinary income tax. If you die and the beneficiaries receive these dollars, they will avoid the penalties and just pay ordinary income tax. And of course, if you ever become disabled, that can also avoid the penalty tax, but you would still pay ordinary income tax. If you don't play by the rules and you're less than 65, you will incur taxes in the 20% penalty. So looking at this example, we've got Erlene, who's 68, withdrew $2,000 from her HSA, going on a cruise. Assuming she has no reimbursable medical expenses, she would pay ordinary income tax on that withdrawal. My opinion has always been, though, why not use that from another bucket, maybe from her 401k or other after-tax dollars, rather than using from an HSA product. In concluding here, You know, before 2004, we never had HSAs. What a nice vehicle now. By funding that account, you're going to have an ability to pay from that medical expenses that Part A, B, C, and D do not necessarily pay, particularly Part B, I should say, because there's a real focus there. The out-of-pocket expenses, the deductibles, all that can be paid out of your HSA and still result in tax-free. In the past, you had to use your dollars from your 401k, your Social Security, or other after-tax investments, which would end up to be taxable, which could mean your Social Security taxes can be taxed at a higher rate. What a powerful means of being able to save and maximize your tax-free bite by having a substantial HSA bucket to pay for these premiums.
That concludes our webinar for today. Thank you all for joining us. We will answer as many questions as we have time allows on air. Our first question comes from Brian. Using Jim and Deb's example, if Debbie is the account holder and they remain in a family high deductible health plan with an aggregate deductible, can Debbie deposit the full family amount?
And that's a very good question. If they still have family coverage, yes, you could make the family contribution. Less, of course, Jim's $1,000 catch-up because he's already on Medicare. But that's a great question.
All right, we have one other question here coming in. Did you say an HSA owner can use an HSA to pay for Medicare premiums of a spouse?
Well, they can, as long as that spouse is over 65 and has an HSA, they could use those dollars to pay for the premiums of that other spouse who is on Medicare.
Great. Does coverage under TRICARE benefits disqualify someone for an HSA?
Yes, actually I forgot to mention that the Veterans Administration law that passed earlier, it did exempt veterans coverage if you use the veterans but not TRICARE. So TRICARE is still a problem. If you're using TRICARE, you'd not be eligible for an HSA.
Very good. Thank you, Whitney. That will conclude our questions. If you guys have any other questions later on, definitely feel free to email us. I want to thank our speakers, Jim Spaniel and Whitney Johnson, for their expertise on the impact of Medicare and health savings accounts. I would also like to thank all of you for your time and participation today. We hope you feel comfortable with how Medicare impacts health savings accounts and would greatly appreciate your feedback on today's webinar. If you could please take a few moments to answer a few quick questions and let us know how well you enjoyed today's presentation. As a follow-up, you can expect an email with today's information that will be sent in a PDF format to your registered email address. As a value add, the worksheets and the presentation are all out on our webinar today and can be referenced to assist your clients. And as an additional piece, we'll be sending out a PowerPoint on features and advantages of HSAs where Jim can assist you in the presentation with your employer groups. Again, if you have any questions that did not get addressed today, please feel free to call our office or email. That will conclude our webinar for today. Thank you.